to our press conference today on additional measures to strengthen the EU's response to the coronavirus pandemic. We have the pleasure of having today with us President von der Leyen, and the President is accompanied by her special advisor, Peter Piot. Professor Peter Piot is a Belgian microbiologist known for his research into Ebola and AIDS. After helping to discover the Ebola virus in 1976 and leading efforts to contain the first ever recorded Ebola epidemic that same year, Peter Piot became a pioneering researcher into AIDS. He has held key positions in the United Nations and World Health Organization involving AIDS research and management. He is currently director of the London School of Hygiene and Tropical Medicine. Peter Piot is connected with us today through the same Interaxio system that we use for our daily midday briefing, so I ask for your patience in terms of the technicalities of the use of the system. We have today interpretation from and into French, English, German, Spanish, Italian, Polish, Greek, Latvian, Dutch, and Danish, as well as international sign language. President von der Leyen will first make a statement, followed by Professor Piot. We will then move to the Q&A session. We will focus first and foremost on questions on today's package. And I can already announce to you today that the President will be back in the press room on the 1st of December for a further press conference after 1 year of mandate. President von der Leyen, you have the floor.
Vielen Dank.
Thank you very much indeed. Thank you. The coronavirus situation is very serious. The situation in almost all member states is worrying. Data from the ECDC show that the virus is quickly spreading throughout Europe. We are deeply into the second wave now. More and more people are getting infected. And last week, the total number of confirmed cases in Europe reached 1.1 million. And the more people who get infected, the more people will end up having to be hospitalized with the virus. Our expectations are that these figures will increase further over the next 2 to 3 weeks, and they'll increase rapidly. The average burden on intensive care units in Europe is about a third of the highest point during the spring. But it's likely that the burden will increase because of the higher infection rate combined with the winter flu season. In comparison with the spring, there's one thing that's striking, really, which is that no member state is unaffected this time. Central and Eastern European countries are also seriously affected. And we're dealing with two enemies at this time. We're dealing with the coronavirus itself and also corona fatigue, i.e. people are becoming more and more fed up with the preventative measures against corona. And I can understand that people are suffering because of this virus. For months we've all been making sacrifices, and I have to say that I'm impressed with what people have accepted for such a long time. People are paying a very high price, a social price and an economic price. A lot of people have seen their mental health affected as well because of the ongoing restrictions on their personal freedoms and the social isolation that we're all suffering from. But now is not the time to relax these measures. The situation is very serious, but we can still change it. We can still slow down the spread of the virus if everyone shoulders their share of the responsibility. So this responsibility has to be shouldered by everybody at all levels, at a regional level, a local level, in member states, throughout the European Union. We have to stop the spread of the virus until we have a vaccine and better treatment to protect everybody's health.
This means that everyone can and everyone must contribute. What we are expected to do is simple. We need to wear masks, and stick to hand hygiene. And we need to avoid the 3 C's: crowds, close contacts, and closed spaces with poor ventilation. And only by protecting ourselves and each other, we can reduce the spread of the virus and thus reduce the impact on our lives and our livelihoods. Mais maintenant,
but we're better prepared now than we were in the spring. Healthcare professionals, for example, know more about the disease and they know more about how to treat their patients. The citizens are better informed, and governments have gained experience and expertise from what happened in the spring. In July, the European Commission asked member states to prepare for a second wave, and we took action. We insisted that member states increase their testing capacity. And we launched a joint procurement of 350 million euros. Those 350 million euros in order to do that. We also created a European gateway to allow for interoperability between the COVID tracing apps throughout the whole of Europe. And the German, Italian and Irish apps are already connected to this gateway. There are 18 others that should connect in November. So in total, it's 23 member states that have an app in place or are developing it. And 52 million have already downloaded the app. And I would urge all citizens to do this. Every user counts, and the success of the app depends on the number of users.
We have remedied initial shortages of medical and other countermeasures through rescEU stockpiling and working with manufacturers. We initiated joint procurement for protective personal equipment, ventilators and intensive care medicine. We insisted on lifting national export restrictions for critical supplies, and we suspended customs duties and VAT on such items. We set up green lanes to allow the proper functioning of the single market and transport. We introduced a coordinated approach to travel restrictions based on common color codes for risk zones. And we concluded so far 3 advanced purchase agreements for safe and effective vaccines so that they can be available to all member states at the same time on the same conditions. 3 others are now in the pipeline. Now, we must build on these foundations with additional measures. And taken together, the package we presented today enables a coordinated approach to data sharing, to testing, to medical and non-medical equipment, to travel, and to vaccination strategies. We are all in this together. No member state will safely emerge from the crisis until everyone does. And that is why you will hear us stress the need for cooperation, coordination, and solidarity. Tomorrow, the heads of state and government will meet virtually. The aim is better coordination. I will call for greater data sharing to the data platform with ECDC. This will help us to know, for example, where there is ICU capacity, or cross-border patient care can be organized when needed. We will also set up a European platform of national science advisors to COVID in order to exchange and align the advice given to the different governments. We recommend effective and coordinated testing strategies in the package of today, and we recommend increasing capacity for testing. Rapid antigen tests are now coming to the market. These can play a significant role, but we will propose an EU approach to approval and use, because only then There will be mutual recognition of tests and of tests results. For our part, we are now mobilizing 100 million euros from the emergency support instrument to purchase rapid tests that we will then distribute to the member states. And we launch a joint procurement to make more available. We call on all member states to link up national apps to the European Gateway in November. We call on member states to participate in a speedy joint procurement of essential supplies, such as medical equipment for the vaccination. We are proposing today to extend for another 6 months the VAT exemptions for the purchase of vaccines and testing kits. And we call on member states to facilitate travel when necessary. So we ask to work together on an EU passenger locator form. We need to maintain for now restrictions on travelling to the EU, but today we encourage member states to make it easier for couples and for families, for example, to reunite. We also propose to extend the green lanes beyond road freight to rail, air and water. And finally, in line with our EU vaccination strategy of the 15th of October, we call on member states to prepare now national vaccination plans and to review them now at EU level. We need to be prepared for the arrival of the first vaccines. There's a lot to do. There are many, many issues to be considered for an effective vaccine deployment. Just think of what kind of infrastructure will be needed for the storage, for example, the cold chains that have to be established, or the question, what groups of population should be vaccinated first? Here we already gave a recommendation, so we asked the member states to work with that. But there's one thing I will be very clear. We will not compromise on the safety of vaccines. There are many issues to be considered, so finally, let's not forget about our commitment to universal and fair access to COVID-19 vaccines for all. We need to continue the Team Europe approach to join leadership in the COVAX facility. The COVAX facility is a huge success. 184 countries have signed up so far. We all know no one will be safe until everyone is safe. Le coronavirus.
Coronavirus is putting us all to the test. Working together, coordinating our actions, and taking our responsibility at all levels. By doing this, we can fight this virus. We can protect our health, and gradually we can get our societies and our economies back on their feet. Thank you very much.